The American people deserve the truth. A recent congressional investigation has begun to pull back the curtain. It reveals a disturbing picture. It suggests that officials within the Biden administration knew about severe health risks tied to COVID-19 vaccines. Yet they chose to hide this information. This was not an accident. It was a deliberate effort to mislead the public. The report details how safety signals were ignored. It shows how dissenting voices were silenced. The implications are staggering. Our government, tasked with protecting us, may have knowingly endangered millions. This is a betrayal of the highest order. The findings are explosive. They point to a coordinated campaign. This campaign aimed to downplay vaccine-related dangers. One of the most alarming risks was myocarditis. This is an inflammation of the heart muscle. It can have devastating consequences, especially for young men. The investigation uncovered internal documents. These documents show officials were aware of the myocarditis link. They knew it was a serious concern, but this critical information was not shared openly. Instead, a narrative of absolute safety was pushed. This narrative was false. It was dangerous. It put countless lives at risk for the sake of a policy agenda. The report paints a picture of systemic deceit. It wasn't just one or two rogue individuals. It was a pattern of behavior across multiple agencies. The integrity of public health is at stake. Internal communications, now brought to light, tell a chilling story. These are not mere speculations. These are emails and memos from within the Biden administration. They reveal a conscious effort to suppress warnings about myocarditis. Scientists and doctors within these agencies raised concerns. They saw the data. They understood the potential for harm. They tried to sound the alarm, but their voices were muffled. Their warnings were dismissed. The official line was that vaccines were unequivocally safe for all. This was maintained despite growing internal evidence to the contrary. The truth was sacrificed for a unified message. Consider the pressure these honest officials faced. Speaking out against the prevailing narrative was career suicide. The push for universal vaccination was immense. It came from the very top. Any data that questioned the safety or efficacy of the vaccines was unwelcome. So when reports of myocarditis began to surface, especially in young men and boys after their second dose, a concerted effort was made to downplay the connection. Memos circulated, advising staff on how to frame the issue. The goal was not transparency. The goal was damage control. The goal was to protect the vaccine program at all costs, even if it meant hiding uncomfortable truths from the American people. The suppression was systematic. This manipulation of information has eroded trust. The Food and Drug Administration stands as the gatekeeper of medical safety. Its mission is to protect public health. It does this by ensuring the safety and efficacy of drugs and vaccines. Yet the congressional report and internal documents suggest a disturbing dereliction of this duty. Key FDA officials, including then-acting Commissioner Janet Woodcock, appear to have been central figures in downplaying vaccine risks. They were privy to the emerging data on myocarditis. They knew the potential for serious harm. Despite this knowledge, the agency continued to push for widespread vaccination. They even authorized vaccines for younger and younger age groups where the risk of myocarditis was demonstrably higher. Janet Woodcock's role is particularly concerning. Emails suggest she was involved in discussions aimed at controlling the narrative around vaccine side effects. Instead of championing transparency, the focus seemed to be on public relations. The agency's public communications often lagged behind its internal understanding of the risks. Warnings that should have been issued promptly were delayed or diluted. This approach created a false sense of security among the American people. The FDA's failure to act decisively and transparently on the myocarditis signals represents a profound betrayal. Dr. Anthony Fauci became the face of America's COVID-19 response. He wielded immense influence over public health policy and public opinion. His pronouncements were treated as gospel by much of the media and many Americans. However, the congressional investigation suggests Dr. Fauci downplayed vaccine risks. He consistently promoted the vaccines as extraordinarily safe and effective. He often dismissed concerns about side effects as misinformation. Yet, emerging safety signals like myocarditis were becoming clear. Dr. Fauci's public statements often contradicted internal discussions. He had access to the same data as other top health officials. He knew about the VAERS reports. He was aware of the concerns being raised by scientists globally. Despite this, his public messaging remained optimistic about vaccine safety. he rarely acknowledged the specific risk of myocarditis in young men. This selective communication created a skewed perception of the risk-benefit analysis. It led people to believe there were no significant downsides to the vaccines. The influence Dr. Fauci held cannot be overstated. As director of the National Institute of Allergy and Infectious Diseases, he controlled vast research funding. This gave him significant sway over the scientific community. Dr. Fauci's role in shaping this narrative and in potentially suppressing dissenting views or inconvenient data warrants intense scrutiny. A disturbing dichotomy characterized the Biden administration's handling of vaccine safety. Publicly, officials projected an image of unwavering confidence. They assured Americans that the COVID-19 vaccines were exceptionally safe. They urged everyone, including young and healthy individuals, to get vaccinated without delay. The message was simple, consistent, and forceful. Any hint of serious side effects was quickly brushed aside. We were told that severe adverse events were exceedingly rare. This public relations campaign was remarkably effective. It convinced millions that the vaccines posed virtually no threat. This was one side of the story. Internally, however, a different narrative was unfolding. Emails and memos reveal that officials were aware of significant safety concerns. The link between mRNA vaccines and myocarditis, particularly in young males, was a topic of urgent internal discussion. Scientists within the FDA and CDC were grappling with the data. They recognized the potential for serious harm. These internal alarms, however, were not communicated to the public with the same clarity or urgency. Myocarditis, the inflammation of the heart muscle, emerged as a significant concern following the rollout of mRNA COVID-19 vaccines. This condition, though sometimes mild, can also be severe. It can lead to chest pain, shortness of breath, heart palpitations, and, in serious cases, permanent heart damage. While officials initially downplayed the risk, internal documents confirmed they were aware of the association. The highest rates of vaccine-induced myocarditis were observed in young men and adolescent boys. This demographic was at a relatively low risk from severe COVID-19 itself. The public narrative often described vaccine-related myocarditis as rare and mild. This was a dangerously misleading oversimplification. VAERS, the Vaccine Adverse Event Reporting System, is often criticized for over-reporting. However, it actually suffers from massive under-reporting. VAERS is a passive system relying on voluntary reports. Studies show only 1 to 10% of adverse events are reported. The true number of cases could be much higher. The American healthcare system contributes to this under-reporting. Doctors are overworked and may lack time to fill out VAERS reports. There can also be reluctance to link conditions to vaccines. The system is designed to detect signals, not capture all events. Ignoring under-reporting while dismissing myocarditis reports is disingenuous. Throughout the pandemic, the public was presented with a stark choice: either accept the COVID-19 vaccines as perfectly safe and effective, or face the dire consequences of the virus itself. This created a false dichotomy. It framed any questioning of vaccine safety as an endorsement of the virus. This simplistic narrative conveniently ignored the complexities of individual risk assessment. It also overlooked the possibility that both the virus and the vaccines could pose risks, particularly to different demographics. The debate was rarely about whether COVID-19 could be serious. It was about whether the novel vaccines, developed at warp speed, were sufficiently safe for everyone, especially those at low risk from the virus. The argument that myocarditis from the vaccine is preferable to myocarditis from COVID-19 infection is often used to justify mass vaccination of young people. However, this comparison is not always straightforward. Firstly, the incidence and severity of myocarditis from COVID-19 infection in healthy young people were also subjects of debate and varying data. Secondly, vaccine-induced myocarditis has distinct characteristics and potential long-term implications that may differ from virally induced myocarditis. To simply equate the two is an oversimplification. Moreover, for a young, healthy individual, the risk of severe COVID-19, including virus-induced myocarditis, might have been extremely low to begin with. The real debate should have centered on individualized risk-benefit analysis. For an elderly person with underlying health conditions, the benefits of vaccination likely far outweighed the risks. But for a healthy teenager or young adult, particularly a male, the calculus was different. The revelations from the Congressional investigation paint a grim picture. They suggest a betrayal of public trust by the institutions designed to protect our health. The alleged cover-up of severe COVID-19 vaccine risks, particularly myocarditis, is a scandal of immense proportions. It has shaken the faith of many Americans in their government and its health agencies. Rebuilding that trust will be a monumental task. It requires a radical commitment to transparency and accountability. It demands unvarnished honesty, even when the truth is uncomfortable. First and foremost, there must be a full accounting of what happened. All internal communications and data related to vaccine safety must be made public. Those who knowingly suppressed information must be held responsible. This is about justice and ensuring such betrayals do not happen again. Independent, unbiased investigations are crucial. Without this, healing cannot begin. Moving forward, public health communication must be fundamentally reformed. The era of paternalistic messaging must end. Citizens are capable of understanding complex information and making informed decisions. Health agencies must present all available data clearly and accessibly. They must